For parents, helping your kids feel better when they're sick is a top priority.
Whether it's cold medicine or a trip to the ER, the key is making sure they have access to good medical care.
Vaccinations and regular checkups are vital, but so is what happens at home in everyday life.
Reporter Viv Williams explains in this Medical Mythbuster.
When a child gets a rare or serious diagnosis, there's no question they need expert medical care.
If you have a baby with a severe congenital anomaly or a child that's unfortunate enough to get a complicated type of cancer, there is nowhere on earth you're better off than in the United States because we do very well with that tiny subset of people.
Dr. Larry Moss says it's the day-to-day preventive care that's lacking, and the U.S. healthcare system has become reactive instead of proactive about children's health.
Reactive means when you get sick, you go to the doctor, you go to the hospital, and we do our best to fix that.
Moss says being proactive involves working healthy living practices into everyday life.
First and foremost, start early. Be well aware that from birth to age 5 is really the time you can make a difference and that it lasts a lifetime.
Nobel Prize-winning researcher James Heckman proved it in a study he led at the University of Chicago. The team followed 2 groups of preschool children for 30 years. One group of kids had a healthy snack every day, access to primary care, and some very basic education in healthy behaviors. The other group didn't have access to those things.
There was a markedly lower incidence of cancer in the study group. There was a lower incidence of diabetes and heart disease. There was a higher median income, and in every respect, there was a better life trajectory.
Moss emphasizes that many aspects of medical care, such as vaccinations, well-child visits, and treatment of serious conditions, are critically important for the health of our children. But even with that care, sometimes kids get bad diseases and it's nobody's fault. But he says children's health in general will benefit if healthcare leaders shift the focus from trying to fix problems that arise to helping prevent them from happening in the first place. With this Medical Mythbuster, I'm Viv Williams.
Well, we've heard it before, an ounce of prevention is worth a pound of cure.
You're right, got to know how to eat well and exercise and do all the right things, and it's good to get them started at a young age, moving around.
Yeah.
All right, up next.